Halimbawa, si Juan, gumaling si Juan because of a dietary modification. Pwedeng si Pedro hindi gagaling. Okay. Last FB Live, we talked about cancer. Okay, and what are the treatment options that you want to do, and what is it that some of the things that you can do once you decide. You have two treatment options. Once you decide if you want to do chemo, radiation, or just basically conventional, and you want to go into natural. Okay, but there are
again, remember, some people choose to do nothing.
But then you have so what are the things to ponder right now? So I mean, you chose a treatment. Okay, for me, like me, I don't want to do chemo. I don't want to do surgery. I don't want to do operation. So what am I? So I'm opting to go to natural therapy. So what are the things to ponder? Number one is that there is no such thing as 100% guarantee.
There's not 100% guarantee on anything other than the fact that we're going to all die someday.
Yeah.
You know?
Like chemotherapy.
Like for example, when it comes to chemo surgery, I can't tell you how many times you had patients come through and they'd have a mastectomy or even a double mastectomy, and they tell the patient, we got it all. And then 6 months later, the patient's dying of liver cancer. That's not bad luck. That's just the nature of cancer due to circulating tumor cells. And then whenever you have a significant surgery or injury to the body releases growth factor molecules to stimulate mitosis. And the circulating cancer cells get that signal as well, which is why surgery can often be a precursor to metastatic spread.
But there was a research or an experimentation that they did in 2000 about chemotherapy, about the efficacy of chemotherapy.
That was an extensive study from the Journal of Clinical Oncology.
This was in Australia. They did it in Australia and in the US, and the result was very not so promising. It's only 2%.
It demonstrated about 2%, and that was the effect as far as adult onset cancers are concerned, which are the majority of cancers that people see. Now there are a few that it appears to have a very, very good result for, but those are very, very limited. The majority of cancers, adult onset cancers, chemotherapeutics, have an efficacy of around 2 to 3%.
So 2 to 3% lang. So like that, there was a research or an experimentation that happened like that. It was a big study. And
meta-analysis.
It tells people that it only has an efficacy rate of 2%. So 2% lang yung success rate niya. So you have also to be careful if you make an analysis. Or if you make a decision on which treatment options you want to go. Like, if you're also gonna go in natural, hindi naman lahat yan 100% eh. Kung may mga success rate, of course, there's always gonna be success rate.
Yeah.
But there's also gonna be failure rate. You just have to be realistic.
Be realistic.
It doesn't mean that if you undergo the treatment, you completed it, that you are 100% cancer-free. In fact, the second thing to ponder is that there is no sophisticated medical equipment that will tell you that you are cancer-free. So, you can do all the testing that you want. Nagpa-cancer testing ka na. You did PET scan. You did CT scan or whatever it is that your doctor would tell you. Sige, magpa-laboratory ka. And then it's all negative. And then after 5 months, after 3 months, magugulat ka na lang, it's positive already. So, pumunta ka sa doctor mo, you're gonna say, Doc, what happened?
Well, basically, at that time, you were free of detectable cancer, utilizing the means that are available. And the means that are available cannot detect every bit of cancer within the body.
Because these are microscopic, you have to understand. So the cancer cells are microscopic. And the most, like what I said, the most sophisticated medical equipment in the world cannot tell you if you are 100% cancer-free. So magugulat ka na lang after 5 months, diba? May cancer ka na naman. And it's already stage 4. So, cancer is a very sneaky disease, okay? So, do not take it lightly.
No.
Okay, that's why on our third things to ponder is that it's very important that prevention. Yan, you focus on prevention. What was the proverb that they say? Like a pound of
an ounce of prevention is worth a pound of cure.
So an ounce of prevention is more than a pound of cure.
Worth more than a pound of cure.
Yeah, and it's very important. That's very important. Kasi pag nagkasakit ka na, di ba? O sakit yan sa bulsa, o sakit sa ulo, sakit sa lahat. I was telling them that if you get sick, it's like, that's a bigger problem.
Oh, yeah.
Yeah, so you have to do your best right now.
Financially, you know?
Yeah.
Mentally?
Yes.
It's debilitating for folks. I mean, so the thing is, like for example, if you're a cigarette smoker right now, you know, you may not be sick right now. But consider, if you will, the type of turmoil you'll put your family through if you develop lung cancer or emphysema or COPD. So the thing is, I know it's difficult to quit smoking. And I can say that because years ago, I was a smoker. I stopped smoking back in 2001 after having smoked for 16 years. And so I can attest to the fact that smoking is very, very difficult. But I can also declare that I'm no better than anyone else out there. I'm just a man. And if I can do it, anyone else can do it.
Oh, yeah.
It's just a matter of determining that your health, your body is more important than that addiction to nicotine. And understand, you'll make 1,001 excuses why you don't want to quit, because you love it, you enjoy it, it relaxes you, it calms you. This is a deadly, deadly device that is simply, cigarettes are nicotine delivery systems. That's all they are. And they are very deadly. So make the determination to quit and stick to it, because if I can do it, anyone can do it.
So Sir Jack is saying that some of the devices that we developed, there's some form of addiction that is associated with that. So, but don't be disheartened, yan, because always have a positive mental attitude, because you can always change. Pwede naman yan, pwede ka namang gumaling sa addiction mo. Like Sir Jack is saying. Okay, so another things to ponder is that treatment modalities, they vary from person to person. So, halimbawa, si Juan, gumaling si Juan because of a dietary modification. Pwedeng si Pedro hindi gagaling. Okay? So, bakit si Juan gumaling? Bakit si Pedro hindi gumaling? Sometimes the body reacts. Okay? Like with certain types of drugs. Okay? Like when you go to a doctor, to a physician, they prescribe you some antibiotics. Sometimes when you drink it, it's effective, but for some people, it's not effective.
Correct.
Because of our biochemical differences. Yeah. So, meron tayong mga pagkakaiba-iba sa katawan natin. So, you have to be realistic. I think some people, they're not that realistic. Okay? So, we always tend to look at other people rather than we look at ourselves. Okay? So, hindi minsan na kapag binigyan ka ng gamot, hindi because nabigyan ka ng gamot, that's 100% already. No, hindi po. So, those are just some of the things to ponder. Okay?